Hello, I'm here to do the insulin preparation video. I will start by doing hand hygiene. I just told the patient that I was preparing their insulin, took a blood glucose level, and made certain their food was coming, called the kitchen, and their food's being prepared right now. If the patient had low blood glucose or didn't have the food coming, I wouldn't administer the insulin in either of those cases. Did some hand hygiene, putting on some gloves for this preparation. Okay. Okay, I checked the 6 rights. Right patient, Melanie Barnes, 7/19/77. The right medication is Levemir to be 4 units done sub-Q, and then a mixture of 6 units of NPH and 4 units of regular insulin. The right time is 0800 for all 3, which is what time it is now. The right route, they're both sub-Q, the mixture and the Levemir. The right dose, I mentioned 4 units of Levemir, 6 units of NPH, and 4 units of regular insulin. So you got the right route, right dose, right patient, right time, right medications, and I'll document it at the end to get the right documentation. I'll be doing the check in 3 places here, outside the patient's room, and then at the patient's bedside. Check the allergies. I have Percocet listed here. I'll go ahead and ask the patient when I get into the room before I administer any medications what their allergies are to double check. And other than that, I will begin to mix the 2 medications together. Okay, alcohol swabs in the drawer here. Okay, I'll start by, I've got my bottles here. I've checked their expiration, and I've inspected the bottles and made sure there's nothing out of the ordinary with them, and they're both good. This is regular insulin here. It's clear. There, you can see it. And this here is the NPH. It is medium acting. This is rapid acting. Short acting, I should say. The rapid acting is quicker onset than the regular is. But you don't want to contaminate the intermediate acting with the short acting. If you do that, then you would be unable to, then it would affect how the insulin affected somebody. It's better the other way. Some intermediate acting, if a tiny bit got into the regular acting, then that patient isn't going to notice a large difference, but the other way it could drop them quickly. So go ahead and alcohol swab both of the vials, and I will get my insulin pen here. For the first, I will add air to the intermediate acting, the NPH. We'll get air first. There's got to be a way to make that visible. Okay, I'm gonna try to find a way to make you see me doing this. Still. Okay. Got to be better ways to film these. Okay, so I did already alcohol swab them both. I will be initially pulling up 6 units of air to push into the NPH, and then I'll have 4 units of air to push into the regular insulin. And go into the NPH first. I will be placing this lid on a cot or on my alcohol swab. which you can't see it, it's off screen, but it's placed on the alcohol swab. Stay there. Okay. So I have my 6 units there. I'm going to go ahead and place 6 units of air. Now I'm going to pull up 4 units of air for the regular. And then without removing it, because there's no reason to, I'm going to go ahead and turn it upside down. Do 4 units. Pulling very slowly, making sure not to get any bubbles if I can avoid it at all. Okay. That is right at 4 units right there. And so now, second is the NPH. And the NPH, I am pulling up 6 units. You always pull up clear, then cloudy, so that you don't contaminate. And so if you do, okay, I'm pulling this to 10. That is right at 10. Okay, so this is mixed now. This is hard for you to, well, you can't see really, but I have a cap. I'm going to use one hand and not bring my other one in to place it into the, place the needle into the cap to recap it. Oh shoot, it rolled off. It went off of the alcohol swab. It hasn't touched anything though, so I'm going to go ahead and continue recapping. Okay. Okay. There we go. Okay, once I have it on there, I go ahead and recap it. So now I have this mixed and it'll be ready for the patient to administer subcutaneously. And I will go ahead and do my pen. To do my pen, I will start by getting my alcohol swab and cleaning the pen cap thoroughly. The instruction sheet says 30 seconds, so I will do 30 seconds. Okay, there's 30 seconds. Here's the needle. Allow for a moment for it to dry. Okay, let's see, it's dried. There's a needle that punctures into it, so go ahead and place that into it, and then twist that on. Now that is on. So I will go ahead and click it to 2 and prime it. So the needle's primed. And now I will return all of my supplies back to their rightful place. I will perform hand hygiene again. And I will take this to my patient. I will do another check outside the room, and then once again at the patient's bedside.